Okay, good afternoon, everybody. Thank you so much for coming to join us here this afternoon at this second of our forum events around Lessons Unlocked, where we're really taking an opportunity to do a bit of a deep dive into some of the core learning activity that's taken place within these Safeguarding Children partnerships over the last year. And really thinking about what that means for us in practice. So we hoped you, if you were able to join us yesterday, where we had research in practice coming along, we hoped you enjoyed that webinar that they presented there. And we'll talk about where you can access the resources from that and the slide deck from that if you weren't able to join us live yesterday. But we do hope that these webinars are useful for you and for your teams, and in particular, in terms of increasing your safeguarding knowledge. Just a little bit of mini housekeeping before we get going. We are going to use the chat function for this webinar. So if you don't have the chat function up already, we do recommend you pull that up. Just click in the speech bubble that says chat in the icons there, and that will bring up the chat. What we will ask, though, is please, can we just keep the chat relevant to the session? So if you've got any questions or reflections for any of our presenters in there, if you need to leave early, please don't feel like you have to add that into the chat, or to particularly thank our presenters in that and part of that if it's if the webinar is still taking place. And it just helps to cut down on any distractions for those attending today. If you do experience any technical difficulties throughout today's session or would like to provide feedback, please feel free to email us at sscptraining@somerset.gov.uk, and we would love to hear from you. We do acknowledge that this subject matter could be triggering for people and quite hard-hitting at times. So please do make sure you look after yourselves today, either throughout the webinar if you need to, or afterwards, where you'll be able to touch base with a colleague or a line manager for support if you need to. Or again, if you do need signpost to anything, please contact us SSCP Training email address, and we'll be able to get hold of you and help to signpost. Just a quick reminder, as always, you can find all of the recordings and the materials from our forum events, both today and previous ones, on the SSCP website. Just go to Learning Hub at the top of the web page there on the tab. You'll find forum events there, and you'll be able to access all of the materials from today and yesterday and all of our previous ones. And just a quick reminder, if you've not been on there before, you can find all of our previous forum events covering topics such as online safety, child sexual abuse, serious youth violence, exploitation, neglect, and many, many more. So in terms of today, so we are talking about Lessons Unlocked, really unpicking some of that learning that's taken place. If you have got any questions for any of our guest presenters today, or for myself, please post it into the chat function by just clicking the speech bubble icon at the top of your screen, and we'll try our best. If we can answer those as we go throughout the webinar, then we will try and answer them there and then. However, we've got an hour's webinar followed by an additional half-hour QA function. So if you are able to stay on for the QA, it's a really good opportunity to directly ask our guest presenters anything. But if you have got questions for them that pop up throughout the next hour, pop into the chat function. And we've got the wonderful Sam in the background who's going to be collating some of those questions for us for when we get to the Q&A as well. But at the Q&A function, you will also have the opportunity to unmute yourselves and ask any of our questions directly to any of our guests. So please do that, because it's a really good opportunity to ask those questions whilst they're there in your mind. So in terms of today, I say we are doing a deep dive into the learning over the last 12 months, and we're really pleased to be joined by Jasmine Walk, the business manager for the Safeguarding Children Partnership Business Unit. We've also got Laura Giles, the wonderful principal social worker for children and families in Somerset, and Katie Harrison, for the senior safeguarding advisor from Public Health as well. Now, just to set the scene really, in terms of what we're going to be talking about today, and also on the national picture, I just wanted to start off giving us a bit of a broad overview really of the learning activity that's taken place within Somerset over the last 12 months. And in the last 12 months, what we've done is conducted 7 learning reviews. Now, if you've not heard of learning reviews before, these are non-statutory reviews where it's not felt to meet the criteria to be notified to the National Child Safeguarding Practice Review panel for a statutory review. So they are non-statutory internal reviews where we still think actually it doesn't meet the criteria, but actually we still feel that there's learning to gain from this one. And in terms of those 7 learnings from reviews, 5 of those have involved babies, children under 1 year old. 2 of those reviews did also involve older siblings within the same family unit. We haven't actually conducted any rapid reviews. So those are the statutory reviews in the last 12 months. And for anybody that's been on our training, you'll know that everything always starts off as a rapid review, but we've not had any in the last 12 months or so. And then also we've had 1 child safeguarding practice review. Again, very much the statutory review there. In terms of the rapid review for that, that was that condensed prior to the 12 months within the timescales that we're looking at today. Now, in terms of that child safeguarding practice review, that is going to form quite a bit of the learning from today. If you've not read that review, it's known as Child C DSPR, Child Safeguarding Practice Review. You can find that on the SSCP website. We'll post a link for that in the chat for you in just a moment if we've not done so already. But if you've not read that review, please take time to have a read of that review and understand some of the learning from that and the recommendations. So in terms of the reasons why those reviews were conducted, they really sort of fall into four broad categories here. One of them, sadly, probably won't surprise you, and that is due to non-accidental injuries to very, very young babies. Another key theme for a couple of the reviews was around child sexual abuse. And again, possibly not surprising, one of those, or sorry, two of those involved neglect, and domestic abuse played a really key theme as well. So these are themes that come up time and time again, and that's not just on a local basis, that is on the national picture as well. And again, if you're not familiar, the National Child Safeguarding Practice Review Panel have recently published their annual report where they look at all of the reviews that have taken place right the way across the country, and they're able to collate that information and really pull out those key themes. So just as a kind of an overarching picture, in the last 12 months, the national panel saw 274 rapid reviews take place in that timescale. So that's right the way across the country. Now, that's actually a decrease from 330 from the year before. So there is a question mark around that, whether or not that means that less children are being harmed and less cases are being notified to the national panel because they don't meet the criteria, or whether just not enough are being notified to the national panel. So it is a question mark nationally at the moment, but we've definitely seen quite a significant decrease from the previous year. Now, in terms of the age range of children notified to the national panel for a rapid review or a child safeguarding practice review, again, for those of you that have been on our training, you'll know that this is a very familiar pattern and actually follows the same theme as the previous year and pretty much the year before that, where we see those spikes at either end of the age range. But the highest kind of area for that are the babies under 1 year old here. Now, in terms of that system learning, again, as you'll just see, it kind of has a direct echo with some of that local picture that we've just looked at. 60% of those rapid reviews involve neglect. Just over half of them involve domestic abuse. But really significantly, nearly 3/4 of those identified that lack of coordination of or handover between services. So it's something that we really need to pick up on both locally and nationally. Now, as you can see from that chart, those babies under 1 year old were most affected in terms of that significant harm here. But recognizing often we do sort of break things up into categories, but many of these children did experience multiple harm, complex overlapping themes that we can see here. So although we might talk about domestic abuse or neglect or mental health issues, often those will be overlapping issues with many, many of those cases. And one of the biggest recommendations from the national panel, which again probably won't surprise you, is making sure we've got those really strong, robust multi-agency working arrangements to make sure we are joining up as multi-agency partners to really work effectively together to make sure we are safeguarding children. So just bringing it back to the local picture, really, and some of the key local learning that we really wanted to bring to you along to you today were these three key themes. And we're going to explore each of these three in turn as part of this webinar today. So we're going to be looking at engaging with families, how we do that and why that's important, what we can do better moving forward, building those strong multi-agency understandings between agencies, making sure we're all on the same page, and making sure we're working effectively and communicating effectively to make sure we can assess risk and understand risk really effectively and make sure we're getting those effective risk assessment plans in place as well. Now, as part of today's webinar, we are going to be running a series of polls because we want to get your feedback from this. We need your input because it's so important as a wide partnership that we understand what is happening right the way across all of the children's workforce here. So we've got 3 polls to run, one for each of these learning categories here. So if you can take a moment as we're going through, have a think about these questions and see if you can respond to them. And at the end of each section, we'll come back and do a bit of a review for you. So that starts us off, and we're going to move on now. And we're going to hear, first of all, from Laura, picking up on that first learning point. So Laura, if it's okay, I will hand over to you.
Thanks, Steve. So yeah, as introduced, engaging with families is the first theme that I'm here to discuss with you. A theme that on first glance can feel a bit challenging to consider. Engaging with people is the core of many of your job roles, and we do it well in Somerset. Reviews and audits, inspection outcomes, they frequently highlight the passion, dedication, and relationship-based practice that really underpins our practice across Somerset. So I wanted to take some time to think about, why is this coming up as an area for further learning for us? Many of the people we work with on a daily basis are vulnerable. They face hardship, they might have been subjected to traumatic experiences, and whilst these are their experiences and lives, we are also human, and all of us are compassionate and empathetic in our work. So we also need to recognise that many of those challenges we normalise in our day-to-day work, we're also challenging ourselves to go against our subconscious instincts on a regular basis. I mean, think about your own experiences in the last week. How many of you have asked challenging personal questions? How many of you might have visited a family on their own, in their own home where they were reluctant to let you in? Maybe some of you have delivered news or an outcome which you knew would be upsetting for a family to hear. Each time we do this, we're having to override our own instincts to be brave and continue in our work because we know that that's what leads to better outcomes for children and families that we work with. But we shouldn't underestimate the extent of this in our practice. And many of our actions have significant consequences for the people we work with. We can be on the receiving end of anger, tears, anxiety, disengagement through not attending meetings or appointments, all of which have implications on how successfully we're then able to engage with families. It's important for us to think about what we mean by the term family. How many of us start by thinking of the nuclear family? Mum, dad, 2.4 kids. And many of our own families won't look like this. Perhaps a single parent household, half siblings, maybe a very active uncle or aunt who supports school runs. And what about friends? The family we choose for ourselves. Do we class them as family? So I know I would. Um, Kinship care was a relatively new term to me as a safeguarding ASYE over a decade ago. But how great is it to hear from colleagues across the county and various services using it as part of common practice, reflecting those increasing successes we see from keeping children within their family networks? What we know is that when we know who a child's family is, how they feature in a child's life, and we engage with them as a whole network, we increase the likelihood of that family being able to address concerns and sustain that positive change in the longer term for that child. Understanding families' needs and providing them with help at the earliest point to avoid escalation also aligns our practice with what families tell us. They want support earlier and not just when things reach a crisis. As Steve mentioned, engaging with fathers and males has remained on the agenda, particularly since the publication of the Somerset CSPR for Child Alex in 2020. And reviews have highlighted the significant implications when individuals are not known, recognised, or supported in their role within a child's life. A more recent 2025 gap analysis for a child where a non-accidental injury was a concern highlighted the impact of missed opportunities to share information throughout pregnancy, and that included specific information about the father's history. We had a further learning review in March this year, which echoed learning from the I Wanted Them All to Notice in 2024 in relation to that identification and response to concerns of sexual abuse, with swift multi-agency action required when a new partner is identified within a family being supported for safeguarding concerns. But I do also want us to look at how far we've come in recent years and recognising that things like domestic abuse can be so much more than physical violence and harm. And the law now recognises what we've known for a long time, those controlling coercive behaviours, non-fatal strangulation and misogyny. They all need to be addressed in order to protect victims. And we all know there is still more work to do, but what are we doing? Well, each and every one of you attending today is demonstrating your continued commitment to that learning and improvement for our children and families. The best practice comes from professionals who welcome healthy challenge, embrace the need to adapt, change, and who see learning as an essential part of their practice. So thank you for taking the time. And it's lucky because change is something we all know very well across Somerset at the moment, but it's such a great opportunity too. And many of these changes at the moment are coming from learning that we're discussing today. With the Families First Partnership Programme in development for all councils, our public consultation gave everyone in Somerset an opportunity to help guide our developments. First and foremost, families told us it was important for them that we listen to everyone in the family, not just one person, more of working with the whole family and listening to the whole family's views. And we're making great strides to roll out the family group decision-making approach. Some of you listening might be aware of the family group conferences that we've been running for some time. They're really supporting families to come together as a network, share their perspectives and create safety plans of their own which really work for them. And we know that a family-led approach means families are more invested in the changes and are far more likely to sustain them. They feel heard, they feel respected, and most importantly, they feel safe. But in order to ensure this happens effectively, we need to make sure we've got a solid understanding of who the family network is right from the start. Things like the genograms and ecograms being started from the earliest opportunity can help us to build an accurate picture of the family network. That really ensures that we're curious with children and families about who they spend time with. We need to remember that to be asking for names and details of those people, meeting with them, observing those relationships when we get the opportunity, really getting to know that family as a whole. And these tools also support us in our trauma-informed approach. Trauma often being something which is experienced across a family network with significant implications. And our trauma-informed network brings together individuals and organisations who are committed to a journey of becoming more trauma-informed in their practice and policy. It really celebrates strength, personal growth, innovation and creativity that can grow from adversity and experiences of trauma. So I'd encourage each and every one of you to visit that website, join the network and help to continue our trauma-informed culture across Somerset. There's some really great resources on there. And then we've also invested in our motivational interviewing approach. And I hope many of you might already be familiar with the wonderful Jackie Webb as part of that. And that's really in line with our position around the importance of family group decision making. And we really recognise that the MI approach has a significant impact on the effectiveness of the support offered to children and families. So we've expanded that opportunity to attend that MI training to all agencies across Somerset. So do have a look on the SSCP training website for upcoming dates and get booked on if you haven't done so already. A really strong focus of this training is on that engaging and supporting families, particularly where there might be that resistance to engage with services, offering support as well as encouraging that professional curiosity through use of those MI techniques. And last but not least, our wonderful business unit colleagues at the SSCP continue to ensure that all of our learning and events, all the opportunities are readily accessible and frequently updated on the SSCP website. And in particular, I want to draw your attention to the Voice of the Child bite-sized briefing, as well as being able to access this presentation today as part of Forum Week recordings. Not only to revisit maybe for your own benefit, but to share with colleagues who might not have been able to attend this session directly today. And that's it from me. Thank you.
Fantastic. Thank you so much, Laura. And so don't worry, you will have the opportunity to be able to access the recording of this webinar and all the slides and any other material afterwards on the SSCP website. So don't panic about making sure you write everything down, and everything will be linked to as well. So thank you so much for those of you who responded to the poll. We will have some more polls running throughout this. So if you've not contributed to this, that first one, please do give us your thoughts on that one, because it's so important we do get your views. And it's also really good to hear some of the initiatives that are taking place. But we're going to do a quick review now, and I'm going to ask my wonderful colleague Sam Sandy to come in, and I've not been able to see them. So Sam, can you give us an overview of what's come in?
Of course, yeah, we've had some great responses. Lots around training offers and extended training that's been gained through organisations, encouragement of participation and coaching coming in through there. Lots of people are saying lots of different elements that are coming in. So care coordinating and safeguarding conversations and involving health coaches within that as well. Having senior leader teams on gates in the morning, as well as an open door policy, and bringing in pastoral teams around targeted work with within that as well. Lots of elements around offering adult services to parents and encouraging them to seek help and support within that. But also another strand within that is updating the sustainability to study policies to ensure parent and carer participation. Great other ones on building good relationships, listening to them as well, real key element in there. Some organisations have done parent family support advisors have introduced community drop-ins called the Parent Place as well. We've also got a nursery who do family events such as Easter egg hunts, teddy bears picnics, obviously needing to keep the cost very low or free, and review of the CMB practice audit and policy involvement. Apologies, I don't know the acronym on that one.
Fantastic. Thank you so much, Sam, and thanks everybody for responding to that one. It's really good to hear all the things going on. We will look to collate those and tap into that more. So thank you so much. Right, we are going to launch our second poll for you just as we lead into our next presenter, which is just thinking about how do you make sure you're all on the same page as other agencies when working with a family, which does take us nicely into our next presentation from Jasmine, the business manager from the business unit of the partnership. So Jasmine, if it's okay, I'll hand over to you. Oh, Jasmine, you're muted.
Already noticed that I've been muted. Brilliant. Thank you so much, Steve. So I'm going to talk now about building our shared multi-agency understanding and how that's come out through learning reviews in Somerset and nationally over the last year. So breaking that down in terms of what do we mean by building our shared multi-agency understanding? Firstly, we're looking at that shared understanding across assessment and risks and those actions. So what is it that gives us our shared language and our shared concerns around, what's needed to support a family? Secondly, we're looking at that information sharing across agencies and getting all of the perspectives that we need alongside the voice of the child, the views of the parents and the wider family to understand really what the risks are and what support is needed. And then thinking of as well about ensuring that the right agencies and roles are involved in those multi-agency meetings. So linking to this as an example, we've had a learning review in Somerset that has highlighted that there was an agency that knew relevant information but wasn't involved in the meetings and the safeguarding processes for that child, so wasn't able to contribute that information. And that's something that we see repeated nationally as a challenge, where getting those right people around the table to have those conversations and enable the best support possible for the family can be a challenge at time. And this kind of thing's really important, especially for contingency planning. So if the risks increase and an agency's ended their involvement, those agencies that are still involved need to understand the background, they need to understand the plan and the family story so that they can keep that continuity of support and hopefully support to reduce the risks. So I just wanted to briefly go back to the report that Steve mentioned at the beginning of the presentation, the Child Safeguarding Practice Review Panel's annual report. He briefly mentioned this, but it's looking at those themes. You can see that it really strongly links back to building multi-agency understanding. So that handover between services, that sharing of information, and agencies speaking to each other, but also that third one down in terms of how we get strong risk assessment and strong decision making is when all the right people come together, share their understanding and support the right outcomes for children and families. As Steve already mentioned, the report does speak about how the children were living with multiple challenges. So that can be neglect, domestic abuse, poverty, family mental health difficulties, substance use. And when these overlap each other over time, it's making it harder to identify the risks or to fully consider the wider family and the whole picture of the child's experiences and what level of support is needed. So in that, the report really highlights the importance of sharing meeting minutes, assessments, all key, recorded documents for a child and a family, so that when agencies do have touch base contacts with the families, they understand the concerns and what plan is in place. And when you kind of break down information sharing and we say it's often between agencies, but actually it can be across departments within one single agency, or it can be across agencies, or it can be across borders as well, in terms of if a family's moved and sharing that information with other areas as well. So information sharing comes up a lot in the partnership, and it often comes up as themes that come through our learning reviews. And when we speak to frontline practitioners, or we speak to managers, or we speak to leaders of agencies, they tell us about the barriers to effectively be able to share information. And they can include kind of having different processes for every agency and every local authority. So if you're an agency that works across a lot of areas, needing to know the different ways and the different routes to share information. Also highlighted is around IT systems that don't communicate with each other, and so the difficulty in terms of accessing information, but also professional anxiety around sharing information and who to share it with and how it can be shared and what can be shared. So we do have a partnership information sharing webpage, and that's for practitioners, and it gives guidance around sharing information, how you can support your understanding, your confidence. So do have a look if you're interested in finding out a bit more about information sharing and kind of the resources that we've got locally in Somerset. So moving on, I wanted to talk a bit about language. Anyone who knows me knows I could probably talk about language all day, but I promised you it's only one slide today. And I wanted to give you some examples of language that's come out of learning reviews locally and nationally, as kind of examples about building a shared multi-agency understanding around a child or a family. So starting with supervision and observation, this is one that came out of the Child Safeguarding Practice Review for Child C. So the circumstances were that in that pre-birth planning period, it was shared between agencies and all agreed that there would be clinical observation of the family while they were on the ward after baby was born. But there was like a misconception that the hospital was a safe place and that there'd be people around and the baby would be seen and would be safe. So what was actually needed for the family was supervision to keep the baby safe. So what was a really key piece of learning that came out of the review was drawing that distinction between the meaning of those two terms and the difference between a clinical observation in a hospital setting and safeguarding supervision. Another example of language that came from a national report I wanted them all to notice, which is a national report from the Child Safeguarding Practice Review panel about sexual abuse. So this term, no further action, was a term being used by the police. And what the report noted was that when the police used this term about a police investigation having no further action, because of like the high threshold for a criminal prosecution, it was influencing the safeguarding response from the other agencies. So it was dangerously creating a misconception that the child hadn't been abused or the perpetrator didn't commit the crime. It was then resulting in insufficient safeguarding responses for the child, and it was leaving children at risk of further abuse or lacking the support that they needed. So what that report recommended was not to use that terminology anymore in kind of multi-agency safeguarding meetings and strategy discussions and things like that. And their suggestion is to say no further action at this time, which is a small difference, but it's trying to draw the distinction that the threshold for a criminal prosecution and the threshold for a safeguarding response are different. And so just because a police investigation doesn't progress, it's still could be absolutely right and the best way forward for a family that a safeguarding response does progress. So again, a really interesting small change in our language in the safeguarding world, but hopefully creating that absolute difference for children in terms of getting them the safeguarding response that they need when they've experienced sexual abuse. So welfare checks, that was a local review that we did in Somerset, where there was learning about what exactly a welfare check was and what it could achieve. So agreement in a multi-agency meeting that a welfare check would be done, and everyone thinking that would that would mean the child would be safe, just because a visit had been completed, but there's difficulty in that one about actually seeing the child. So this was another example where really digging into what the different agencies understood a welfare check would achieve could have really helped in terms of building that shared multi-agency understanding of the plan in place for the family. And then finally, yeah, I wanted to talk about neglect. So there's been another recently published national report called "Why Did It Take So Long to Respond?" about neglect. And there's a really interesting piece that came out through there about, it was actually saying when the word neglect is used rather than like a more neutral term like poor home conditions, they were recommending that it's used because it lends more weight to concerns, and so that concerns wouldn't be dismissed as minor, and that serious concerns about neglect would be recognised and addressed. It's really interesting, and I think one last example I'll give is one that we had in a local review in Somerset, and it was in terms of an agency reporting a concern to another agency, asking for a response from that agency, and they used the term kicking off, but it wasn't understood in the same way by the other agency. And I think that's a really useful example to think about in terms of what you might think the term kicking off would mean and what level of risk to the child would be involved in that term. But another really useful example where you know, speaking to each other, communicating between agencies, that real importance of making sure that everyone fully understands the level of risk, and using the language that we need to communicate that level of risk. Right, so I wanted to move on and just finish up my section talking a little bit about some of the things that we've been doing as a partnership as a result of some of the learning that I've talked about in my section. So in terms of what I talked about earlier, in terms of getting those right agencies around the table, it's really positive this year that the housing team in Somerset Council confirmed a generic mailbox for safeguarding meeting invitations. So that would be for kind of specific housing issues. If you're working with a family, and it would be really important to have someone from the Somerset housing team to come along and get involved in that team around the family and the support being offered. And that one is, the email address is housingoptions@somerset.gov.uk. And then some of the other things we've been doing across the partnership. So we've been amending our pre-birth planning meeting template to provide that clarity on the difference between observation and supervision. So you'll be able to see that kind of in the paperwork and the processes that we have in the partnership to make sure that there's that real clarity around what support a family needs while they're on a hospital ward. We've been working as a partnership to increase getting the right agencies into the right meetings to get the right decisions made for children and families. Talked about changes to terminology on the last slide as well, and mentioned our information sharing webpage. And then just finally, we actually did work with the National Child Safeguarding Practice Review Panel to create a 7-minute briefing, so a summary of some of the key learning from the Child CSPR. So we'd love to share that with you and for you to have a look and a bit more of a dive into the learning from that report. Great, so I think that takes me to hand over back to Steve and Sam.
Lovely. Thank you, Jasmine. And again, thank you for everybody popping your responses in the poll. It is really appreciated. Don't forget, if you have got any questions as well for our guest presenters, you can either hold on to them, but even better, pop into the chat now, and we'll collate those for the QA function afterwards. So in terms of our poll review then, what do we have coming in then, Sam? So the question posed was, how do you make sure you're on the same page as other agencies when working with a family? Really picking up from what Jasmine's just been talking about there. So Sam, over to you.
We have had an amazing response to this. So lots of the things coming in is around communication, MDT meetings and tax, changing language to child not brought. So again, taking that ownership off of the child and back onto the parents. Direct liaison, good communication coming up again, sharing important information, working in collaboration, regular multi-professional meetings, but also understanding each other's roles within that as well. Disseminating written care plans as well. Ensuring that there is strong communication, doesn't matter how big or small that information is as well. Really ensuring those bits. Voice of the child coming through strong as well. Also voicing when we don't agree, as long as it's done respectfully at the same time as well. Communicating in between meetings as well, not just hosting it for that meeting to take place. Information sharing continuing to come around here. Regular meetings led by social worker, team around the child in need meetings, core meetings, as well as informal chats coming from there. Putting the child at the centre of communicating, professional curiosity with regards others' reasoning, open dialogues coming in with that one. Ensuring that early help assessments are writing of the contributing to and also attending initial child protection conferences as well as reviews as well. So putting that at the forefront of our responsibilities. Knowing what pieces of work is being done by each agency, ensuring we know everybody's concerns and strengths as well. So making sure they're voiced within those meetings and not held to the side within that. System access and also raising professional differences as and when required. And there we go.
Fantastic. Thank you, Sam. And again, thank you everybody for that response. Just picking up on a couple of those, a couple of you mentioned about resolving professional differences. So important that we do embrace that. You know, if you don't feel like the right course of action has been taken to safeguard a child, we should be using resolving professional differences. And you know, we shouldn't be seeing that as a negative thing. We should be embracing that professional challenge to make sure we're getting it all right. And I wanted to pick up as well. I know somebody popped in there about the terminology, and instead of saying the child didn't attend their appointment, or, for example, to child not brought. I know, and if anybody has the link for this, please feel free to pop it in the chat, because there's a wonderful little animation around that, told from the perspective of a child who was not brought to an appointment. It's a lovely, beautiful animation. If I can find it myself in the background, I will, and post it in the chat if anybody wants to do that. But for whoever posted that in there, or if you know the chat, pop it into the chat. It'd be really nice to share that with everybody. Okay, so we're going to move on now to our third and final poll question for you. But don't forget, if you have got any questions for our guest presenters, feel free to pop that into the chat. It'd be wonderful to hear from you and any questions you've got. This final question of on a personal level, really, what is it that helps you, and amongst everything else that's going on, to step back and reflect on changing risks and changing strengths with children and families? And that's now very much what Katie's going to pick up on from public health. So Katie, if I can hand over to you.
Lovely, thanks very much, Steve. So to start off, I'm going to be talking about how we can be responsive to changing situations. So when we think about risk assessments, it's really important to recognise that completing one on its own is not enough. So a consistent theme is that risk assessments were in place, but they were not then revisited when circumstances changed. So the heart of effective safeguarding is a responsive approach to changing risk, not a static one. Reviews often show that risk assessments did become static. They were completed at one point in time, but not updated as new information emerges. So that's why they need to be treated as live documents that reflect the child's current experience. Another key learning is the importance of recognising patterns. So practitioners may respond to individual incidents, but without stepping back to look at the broader picture, the cumulative impact of harm can sometimes be missed. There is also a risk of normalising concerns. So over time, long-standing issues, chronic issues can come to be seen as typical for families, which can then minimise the level of harm and also reduce professional curiosity sometimes as well. We know from reviews that serious harm often occurs during periods where concerns were already known, but they were not then actively challenged. And this reinforces that safeguarding action should be driven by changes in risk and not waiting for scheduled reviews. Practitioners do need to feel confident using dynamic risk assessments, adapting plans in real time and bringing professionals together as and when needed. Strong practice includes clear contingency planning, which I'll go into in a bit more depth in a second. That basically accommodates understanding what the triggers are, what actions will be taken, who is responsible, and how quickly we respond. Just to note as well that there is a hospital risk assessment in place in Somerset, which supports practitioners to plan around a child's birth where there are significant safeguarding concerns. The other thing I think it is important to note about our county of Somerset is that we do border a lot of other counties. So a lot of our pregnant people within our service might actually be giving birth at one of the other hospitals, essentially Bristol, Dorset, Devon. So it's really important that we work closely with those other localities to figure out what risk assessments they have in place, what tools they have to use alongside our own ones, so that we can make sure we're providing that holistic assessment to our pregnant patients. Okay, so moving on to contingency planning. One of the consistent themes we see from both local and national reviews is a tendency towards over-optimism in planning. Professionals can sometimes hold on to the hope that situations will improve. We all want what's best for our families at the end of the day, but sometimes that can mean that we don't always plan for what might happen if changes don't occur. Contingency planning is what helps to address this. It ensures that we're not just planning for the best case scenario, but also thinking ahead about what we will do if the risks remain the same or if they increase. Reviews also highlight that without this clarity, cases can drift. Risks may build over time without decisive action being taken, and practitioners can feel uncertain about when it's appropriate to step up that intervention. Contingency planning helps to reduce that uncertainty. It sets up clear, pre-arranged triggers for escalation alongside explicit thresholds and actions. So that means that when risk changes, there is less delay and professionals are supported to take timely and decisive action. Ultimately, it is about being prepared so that if things don't improve, we already know what needs to happen next. Recognizing that risk changes and the impact of this. When we think about risk, it's important to understand that it is not static. It can change quickly in response to life events such as relationship breakdowns, bereavement, housing instability, or sometimes even a loss of support. In some situations, risk escalates suddenly, but in others, it might build gradually over a period of time. A key theme from reviews is the role of stress. Stress is often present in families where serious harm has occurred, and it can take on many forms: financial pressure, deteriorating mental health, domestic conflict. The list is kind of endless, really. Stress will come in different forms for every single person, but it's really important to note that stress can reduce a parent or carer's ability to provide consistent care and protection to their child. We know that the impact of stress can sometimes be misunderstood. For example, inconsistent engagement, missed appointments, or hostility toward professionals may be seen as non-compliance, when in fact it can be an indicator that risk is increasing and there is stress going on somewhere in their lives. Reviews frequently highlight missed opportunities where these signs of stress were present, but they were not fully recognised or reassessed. It's also important to recognise that stress doesn't just affect families, it can also impact professionals too. For example, high caseloads, time pressures, and the emotional impact of the work can lead to cognitive overload, and this can then sometimes reduce professional curiosity, delay escalation taking place, or lead to accepting explanations without sufficient challenge. Linked to this are common biases we see in reviews, such as optimism bias, where we downplay concerns, and also confirmation bias, where we look for information that supports our own existing view. Risk often increases at key transition points, such as discharge from hospital, step down in services, or case closures, and these are times where we need to be particularly alert and responsive. Overall, the key message is that we need to remain alert to how risk evolves and ensure we are continually reassessing in light of new information and changing circumstances. So the risk of relying on an existing plan delaying action. A key learning from many reviews is that the issue is not the absence of plans. Plans are often in place, but there is an over-reliance on those existing plans when risk has then changed. So what this can look like in practice is a child having a child protection plan in place, but when new signs of, for example, neglect emerge, professionals assume that the plan is going to address this rather than taking immediate action. Similarly, we sometimes see situations where new disclosures or injuries are identified, but instead of responding straight away, professionals wait for the next scheduled multi-agency review, which can then delay necessary intervention at a critical time. Another common theme is the idea that it's already being dealt with, and this can lead to a lack of ownership from agencies when no professional takes responsibility for responding to the new risk, and then opportunities to act are missed. The key message here is that risk assessments and plans must be dynamic. They should evolve in real time as new information comes in and not remain static documents that we rely on for reassurance. It's also important that we don't become complacent. So the presence of a plan does not mean that a child is safe. Practitioners must remain alert and ready to act promptly whenever new or worrying information arises. And ultimately, we need to ensure that plans support action and do not delay it. So we've briefly mentioned resolving professional differences. I think that came up as part of the last poll. So one of the key learning points from both local and national reviews is that delay and drift continue to be recurring issues. And this often happens not because professionals don't have concerns, but because there is uncertainty, disagreement, or a lack of timely challenge. We also know that poor information sharing, unclear communication, and different interpretations of risk can all contribute to this. That reflects back to what Jasmine was talking about earlier. When professionals are not aligned in their understanding of risk, it can lead to hesitation or inaction. Learning reviews frequently highlight that practitioners did have concerns about plans in place for children, but those concerns were either not voiced or they were raised once and then not escalated further when the response was not satisfactory. That represents a significant missed opportunity to protect the child. Looking at our own local data in Somerset, we can see very similar themes. The most common reason for raising a resolving professional difference is actually concern about care planning, which accounts for almost half of all RPD cases. And alongside this, there are ongoing issues around communication and delays in processes such as strategy discussions taking place. We also know that most escalations come from education, with less consistent use across other agencies, which then raises questions about confidence and whether all professionals feel equally able to challenge that process. Encouragingly, where the process is used, it's often deemed to be effective, with most cases being resolved and positive outcomes reported. The key message is that effective safeguarding relies on a culture where professional challenge is expected and supported. And if concerns remain, they really must be escalated and not left. Ultimately, if something doesn't feel right, it's really important that you say so, because professional challenge is a vital part of keeping our children in Somerset safe. Okay, so the use of chronologies and other opportunities to assess risk. Chronologies are really valuable tools because they allow us to take a step back from individual visits and see the bigger picture built up over time. When we're working case by case, it is really easy to miss patterns or repeated concerns. They help us to identify emerging risks, understand whether change is actually being sustained, and they provide clear evidence to support decision making. There was a recent public health nursing case review highlighted a family where there were concerns around neglect. There were multiple practitioners that visited this particular family's home on approximately 10 occasions over a 5-month period. And during each visit on our record keeping system, it was documented that the 2 older children, aged 3 and 6, were observed to be sitting in high chairs, whilst the youngest child, who was a baby, was consistently placed in a baby bouncer. Although practitioners did have discussions with the parent about this and the appropriateness of having those older children in high chairs, it was not initially identified as a significant concern, despite being brought up multiple times. It was only then, when a chronology was completed, that the repeated pattern became clear, and it allowed the level of concern and potential risk to be fully recognised, that actually those children had significant developmental delay, likely as a result of being having prolonged use in those restraint high chairs for a long period of time. The SSCP have also released a chronology template, which is available on their website, which is really helpful. I think at the moment, when agencies create chronologies, they can all look very different. So using the SSCP template is going to help us to standardise that across the partnership, so that we're all kind of giving the same information when we are completing those chronologies. So moving on to the topic of supervision. Supervision is a key opportunity to step back and reassess risk. It gives us a fresh pair of eyes on a case, and supervisors can often identify things we might have missed, such as gaps in assessment, overlooked risks, or actions that haven't been completed, for example, like the Strength and Needs Toolkit or a DASH assessment. Working together to safeguard children highlights that high quality supervision is essential because it supports reflection, it strengthens analysis, and it leads to better informed decisions. Within public health nursing, we've over the past year introduced a group supervision model that takes place every 6 months, and it is mandatory for our practitioners to attend that. It helps to bring together health visitors, school nurses, and also our assistant practitioners. How we do this is that we use an anonymised family scenario based on a real Somerset family that has come across our service, and this creates a safe space for practitioners to reflect and be more open and critical. What we found as a service is that people are often more objective when they're discussing an anonymised case than a case that is on their own caseload, where they may feel more personally invested in these families. And this model allows practitioners to really analyse what's happening, consider alternative approaches, and think about risk in a deeper way. But because we do it in a group session, it also allows practitioners of different experiences, people that have been with our service for longer or shorter periods of time. It allows them all to learn from each other's experiences. And what you often find with safeguarding is there is kind of never one right answer. You might have lots of different approaches as to how you can safeguard this child. So it's a really nice way for our practitioners to share their views and experiences and have a really valuable conversation about what we might do differently next time for those sorts of families. Importantly, the learning from these sessions can then be applied back to their own caseload. So we've had really positive feedback from our staff who say that they find this approach really helpful in developing their confidence and their reflective practice as well. So perhaps that's something that you can take back to your own services to see whether that provides a different perspective for you. So moving on to the topic of ICON, hopefully some of you will have already heard of ICON, but if not, ICON is a simple evidence-based message to support parents and carers to cope safely with infant crying. It stands for infant crying is normal, comforting methods can help, it's okay to walk away, and never ever shake a baby. So reviews involving infants consistently show that crying itself is not the risk, but it is unmanaged stress that then increases the likelihood of harm. And these reviews rarely identify a sudden single crisis. Instead, they tend to highlight a pattern of stress building over time. And in that instance, coping strategies then reduce, support is not accessed, and opportunities for early intervention are missed. Crying often peaks at a time when parents and carers are sleep deprived, feeling isolated, experiencing mental health difficulties, and managing wider stresses such as housing, finances, and relationships. This combination can trigger emotional responses such as feelings of failure, frustration, anger, and sometimes a loss of control as well. Reviews also highlight that professionals may underestimate the emotional strain on parents, while parents may minimise their difficulties due to fear of judgment from the professionals working with them. And ICON helps to reframe the conversation, moving away from why can't they cope to what support do they need to cope safely. You'll see on the screen that there is a My Personal ICON plan just on the right-hand side there, the one with the green template. That is a tool that can be used to encourage parents to think ahead and plan for difficult moments. It supports them to recognise their personal triggers and early signs of stress, to identify safe coping strategies such as placing the baby in a safe space and stepping away, taking a moment to regulate their emotions, identifying a trusted person for support when they're finding things challenging. So if you are working with families, it's really worthwhile downloading that template off the ICON website and going through it with families, and then leaving them with a copy to, put on their fridge or on top of their mantelpiece or something, so that when they are finding things difficult, they can pick it up and reflect back on it. The key message is that stepping away safely is a protective action and it is not a failure of parents. And it also reinforces that asking for help is a strength and an important part of keeping babies safe. The SSCP has many resources relating to pre-birth and the early years, which also complement ICON by promoting early preventative conversations during pregnancy, consistent messaging about coping with crying, and a focus on planning ahead rather than reacting in crisis. They support practitioners to prepare families for the reality of infant crying, ensure parents know where to access support, and embed contingency planning as part of routine practice. And this approach helps reduce risk by ensuring families are informed, supported, and better equipped before stress escalates. Icon links directly to contingency planning because it promotes that anticipatory guidance rather than reactive responses, ensuring that parents have the tools, the understanding, and the support to cope safely when it matters most. And I'm going to hand back over to Steve.
Fantastic. Thank you so much, Katie, and to Laura and to Jasmine as well. So just to start pulling things back towards the end now, we're just going to do another quick review of the polls. Again, thank you so much for the number of people that have posted those. And Sam's messaged me in the background say, actually, those of you that posted to previous poll questions as well. And we will look to collate those as well and post them on the responses to those on the forum page there for you as well, because it'd be really interesting to see all of those collated. So, Sam, what do we have in terms of feedback from what helps you to step back and reflect on changing risks and strengths?
So we've got, again, some great responses. A lot of what was picked up in Katie's session as well. We've got around regular supervision and chronologies coming in on that. Ensuring you're regularly capturing the child's voice. And I know something that we all often pick up on in training is not just capturing that, but making sure we're getting the right interpretation of what the child wants us to hear from that as well. Having your immediate team around you and the conversations with colleagues coming through, as well as peer support. Plotting progress, as well as identifying new risks coming from there as well. Listening to other agencies, really highlighting that multi-agency support there. We've got around having these sorts of webinars coming in is a real useful element, allowing people time to reflect, having that supervision one-to-one with managers as well. Also professional curiosity. Regular discussions with the family, so bringing in that family-led practice as well as with professionals there. Talking with your team, revisiting the plan. And I've got a lovely element here to say we hold regular weekly pastoral meetings and that allows us to look at the children raised that week around their well-being, behaviour, safeguarding, and those meetings involve senior leader teams, SENCOs and pastoral leads, as well as writing those chronologies can be a useful way to pull together a larger picture within that as well. And that's it all.
Fantastic. Thank you so much, Sam, and thank you to everybody for responding to those polls. Really good to kind of hear those bits of input. So we will collate all of that. We will put it on the webpage after today. So one final poll from us before we get into the QA session is we'd really appreciate sort of hearing back from you about how useful you find these forum sessions. It's so important we do get your feedback. If it's been useful, let us know. We'll keep doing it. If it's been terrible, that's fine. Let us know, and we'll either change it up to make sure it's relevant for you, or we'll start doing something completely different. So we have kind of reached the point now where we have got our QA function. But before we do, just a very quick kind of recap, a few takeaways from today. One, first of all, is remember we talked about engaging with families, and that very closely keys in with the huge kind of national shift now to making sure we're really understanding a child's lived experience. And that's sort of coming very strongly actually from the national reviews for Star and Arthur, where we didn't engage with the whole family network. And as Laura talked about, that very much being supported now in all of the changes that have recently taken place in working together to safeguard children. We've got the Families First Partnership Programme, which has been driven by partnerships right the way across the country to make sure we've got that family-led practice. And it comes right the way through in all of the national reviews, such as national panels, Protecting More Vulnerable Babies Better, and Trauma-Informed Practice, of course. So we're very much keying into those. That shared understanding between agencies, making sure we're on the same page, not just in terms of understanding, but as Jasmine talked about with our language as well. If we're asking for a home visit, or if we're asking for somebody to supervise somebody, what does that actually mean? Make sure we're on the same page from that. And that risk of thinking we're on the same page, but we may not be, and thinking that somebody may be doing something when they're not. And as Casey's just talking about, making sure we're responsive to the situation, even if sometimes there are some really good plans in place, that's great, but we can't distract from that dynamic risk assessment. What's happening right in front of us here and now, and how can we make sure we're responding to keep a child safe here and now, even if there are sort of longer arching plans taking place in there as well. So, starting to pull things together. Don't forget, yesterday we did have Research in Practice come and join us, and we asked them to pick up on some of these really key themes, particularly around assessing risk and assessing the needs of families, particularly looking at dynamic risk assessment, as I've just been talking about. Unfortunately, that session we couldn't record it, but the presentation and the resources from the Research in Practice webinar are on the website now, so please do access that. Okay, right. Well, we have reached the time to hear your questions. So please, if you do have any questions, please do either pop them in the chat, or if not already, you will be able to unmute yourselves at any second now. If you have got a question, please pop your hand up using the raise function in Teams. Just make sure we get everybody's voice captured and I don't leave anybody hanging there. Before I do, though, I'll just see if what have we got in the chat. I have had a couple come into me. I think one's just been posted. Thank you, Samantha. And for all of our guest presenters, I'll stay on here as well. Question is, thinking about ICON, it shows brilliantly how knowing and understanding other agencies' roles are vital, as the health visitor is well placed to follow up the needs of the child or family if contacted by the professionals involved. It would be lovely to have more multi-agency supervision. Thank you for that, Samantha. So, yeah, really important takeaway from that. I think something we've got to take on board. And like I say, when we talk about ICON, that's not just the role of health visitors, that's everyone's role there to come together and work together. Samantha, do you want to bring in? Can I bring you in now?
Yeah, sorry, I just wanted to add a little bit to that, really, to my statement, because it is certainly, as relatively new to health visiting myself, you can feel quite isolated when you're dealing with your families, especially if you're looking into the safeguarding situations of sort of what we're saying, all of our different understandings and the language we use. So I think just sort of really understanding other people's roles, that's been one of my big learning curves over the last year or two, is understanding who I can also draw in to support me with the family, and sort of what my own limitations are.
Yeah, absolutely. Thank you for sharing that, Samantha. And absolutely, and this is why we've got to come together. We've got to work together as multi-agency partners, because we're all here for the same thing. We're all here to keep children safe, and we might have different roles within that. We might have that might look differently depending on what we have. But the more we can come together and work together and support each other, the better. I think especially at times where things are difficult, things are stretched. There's staffing shortages right the way across sort of what we described, I suppose, as key worker roles. But the more we can come together and support each other with that, the better. And ultimately, the better the outcomes are for children. So, yeah, thank you so much for sharing that. Okay. Thank you, Suzanne. Hi, Suzanne. Good to see you here. Comment about Young Somerset. Have a great early years provision working with parents directly. You may be already a bit aware of it. If you're not, Suzanne, feel free to pop it in the chat, and share that with everybody. That'd be much appreciated. Okay, so don't forget, if you have got any questions, pop your hand up for me. I have had a few come in to me, so I'll read these out. And please, for any of our presenters today, Jasmine, Laura, Katie, feel free to come along and see what we've got. So the first question I've got posed is, are there any supporting resources or training available to help us with shared language? So partly about that around training, so that's partly for me. But before I kind of respond, is there anything from any of you three?
That's a really good question. I think that's something I'd really like to see more of, like nationally and locally, because it's so important.
Yeah, I agree. And just from a training perspective, as far as I'm aware, I don't think we have anything specifically about that. But in terms of our training, absolutely, it's one of the core bits of messaging throughout all of our training at the moment. But yeah, I think it's a really good point and something we can certainly look into moving forward. Laura, Katie, sorry, I didn't know if you had anything to add to that?
No, I think just to kind of echo your sentiments there around, I think that'd be something we'd be keen to kind of come together and have a think about. Really, we've been doing a lot internally in children's social care to really think about the terminology we're using and how what we're recording about children also has an impact later in life when they're reading back over records and information about themselves, how we're phrasing things. So some real key ones like referring to them as a child rather than a case. And we've linked in quite a lot with our sick and slick children in care councils to get feedback from them around actually the impact of the language we use. So maybe we could kind of involve them a little bit more in thinking about some resources more widely for us as professionals to really think about the impact of our language for them.
Brilliant. Lovely. Thank you both. Okay, another question for us then. So picking up from the presentation today, are there any plans to have a better joined up approach between adult and children's services? Good question. To help address the better risk assessments with elements such as neglect or domestic abuse or anything else. So I'm going to throw that out there. Any plans to have a better joined up approach between adult and children's?
I know more recently we've done quite a bit of work, and we've got our transition to adult social care team now who support when children are moving into the adult social care arena, and we're sort of building that relationship much more strongly, and we've started exchanging kind of CPDs with each other, so we'll kind of go along and present a CPD for them and vice versa. And so I think that's definitely something that we're wanting to continue building on, and that's quite an interesting point there around, yeah, particularly those issues around neglect and domestic abuse, to really incorporate that, because what we do know is when we've got the right professionals around the table and they're sharing information in those forums, that it makes for much more holistic and robust risk assessment.
Yeah, thank you, Laura. And it is a really important. In fact, it was a point that was raised in the National Panel's previous annual report as well, particularly thinking about adult mental health services and adult social care, making sure we're sort of joining up better. And I think, yeah, this is a national kind of theme and something that definitely everyone's kind of working towards, and we need to think really carefully about. But I think some of the kind of talk we've already been considering, things like the Families First Partnership Programme of, you know, bringing multi-agency partners together can only help with that. So I think it's probably fair to say nationally it's still something that still needs evolving quite a lot. But certainly there's kind of green shoots of, you know, recognising that needs to happen in the first place, which is always the first step, and then actually starting to make those changes we've been talking about, Laura. So thank you. I'm going to come to a question from Karma. Hi, Karma. In respect of young carers, we have actions within our strategic plans to improve the joining up between children's services and adult services. We also do joint transition assessments with Thrive. Fantastic. There we go. So it's really nice to sort of see these initiatives taking place and recognising these need for this. So great stuff. Okay. Another question for you. Where are we? Let's find this one. Okay. So interesting question, this one. Picking up from what we've been talking about, are senior managers on board with the recommendations? So those we've just been talking about, so they can help support with workloads, supervision, more time allowed to allow workers to fulfil these responsibilities, as well as to make sure we're engaging with wider family networks. Yeah, really good question, that one.
I can take that
please.
one. Yes, because when there is a national review or a local review in Somerset, it's senior leaders that oversee the actions that we agree and how we're going to move forward and implement that learning in Somerset to improve our safeguarding system. So absolutely, you know, they are on board, and all the learning that we've described today they've been involved in those reviews and making sure that we're responding to that learning locally in Somerset.
Yeah, brilliant. Thank you, Jasmine. Laura, Katie, anything to add to that?
Just from a public health nursing perspective, you know, I touched on the group supervision model that we've brought in, which we have made as a mandatory 6-monthly experience for our practitioners, but we're also really keen to get their team managers involved with that as well. So each team manager comes into that group supervision also. I think it's really important for them. So within public health nursing, our team managers don't tend to do as much home visiting as perhaps some of the social care managers do. So I think it's really important for those practitioners that aren't visiting as much anymore that they still keep in touch with what is happening on the ground and, you know, the experiences that their practitioners are having whilst they're out in practice as well. So from a public health nursing perspective, our kind of supervision models are really well supported. And I think, as Sam, one of our health visitors, said, it would be really great if we could maybe introduce some more kind of multi-agency supervision as well. I think we kind of miss out on that, and that's just another opportunity for us all to learn from each other and learn more about each other's roles.
Definitely. Lovely. Thank you, Katie. Laura, before I move on, anything from yourself? If not, that's fine. But
I think I can just echo the sentiments from Jasmine and Katie, really, and agreeing that our managers are definitely on board with this and really keen. I think particularly with the Families First programme, seeing that as a great opportunity to think about those things around, you know, have we got the right staff in the right places doing the right things, and how we're looking at things like caseloads, use of supervision to make sure that we're really doing the best that we can for children and families in Somerset.
Lovely. Thank you to all of you for that one. Okay, just a couple more, and then you can breathe a bit of a sigh of relief unless there's any other questions that are coming in. And again, if you have got any questions, feel free to pop your hand up or to pop it into the chat, and I can read those out if you're feeling shy today. Okay, so another question about resources and support. So is there any support to help us have these brave conversations? Any resources, training, or anything like that? I'm happy to pick that one up to start off with if you like, but again, feel free to jump in if you got a response to that one. And one thing I would say, which I think, Laura, I think you mentioned it at the start there, which I cannot recommend highly enough, and that's the motivational interviewing training. It's not a magic wand. It's not going to kind of give you everything, all the solutions to everything. But I would say if you've not done motivational interviewing training, as Laura mentioned, it is run through the SSCP, run by Jackie Webb, that was mentioned earlier. Jackie's absolutely amazing. We run it as a free to anybody to be able to access that for completely free. It's a one-day introduction to motivational interviewing. Just to say, if you work within children's social care, don't do that one. Within your own learning development team, there's a 3-day course. But if you're not from within children's social care, you can access that introduction to motivational interviewing with Jackie. I can't recommend it enough. And if you don't know anything about motivational interviewing, if you think I'm not sure if it's for me or not, we have done 6 podcast episodes with Jackie about motivational interviewing. The first one gives a really good overview. The subsequent ones that go into more detail about sort of specific methods within that. The last 2, we had one of the consultant social workers coming in, talking about how she's used it in practice and sometimes in some really, really challenging situations, which personally I wouldn't have liked to have been in those situations, but she demonstrates how it can be used so flexibly as well. So it's not the be all and end all to everything, but I really would recommend it really highly. So it's motivational interviewing training. You can find that on the SSCP webpage on the training page for you. Jasmine, Laura, Katie, is there anything you wanted to add that at all? No? Okay, great stuff. And then the last question that I've got in, but again, if you have got any questions, do pop them in the chat or pop your hand up, is I'm interested in knowing more about domestic abuse and non-fatal strangulation. Excellent. Is there somewhere I can find out more information, please? I can probably answer this one, but again, if any of our presenters want to jump in, please do. So at the moment, I can't talk too much about it, but there is work underway, particularly looking around domestic abuse and particularly about domestic abuse training for certain sectors. Also making sure, links in actually to the earlier question, that we're not necessarily just thinking about children, and we're bringing in the learning from things like these significant adult reviews and from domestic homicide reviews mixed in with the learning from the child safeguarding practice reviews focused on children, because it's so important we don't join up those dots. So there's work underway around that, so keep your eyes peeled for that one, because there's potentially some quite exciting developments around that, which I can't talk about at the moment, but hopefully shortly on the horizon for you. And in terms of non-fatal strangulation, yeah, absolutely, really interesting you picked up on that. So we have done a podcast previously with Dr. New Lubery about non-fatal strangulation. It's a really fascinating one. I'm not just saying that, I've genuinely found it really, really fascinating. It's an area I didn't know much about, and it was one of those, after I did the recording, I came away going, wow, that was really, really interesting, because we need to think about non-fatal strangulation and the risk with that, not just in terms of that escalation of risk and violence towards somebody, and what that can indicate, but also in terms of the health implications, particularly for women who might have experienced that in terms of blood clots and things. So, and how we need to respond to that quite rapidly if we have concerns about that, but also thinking about that in terms of, for example, teenage relationships. We know, sadly, in fact, I was listening to something the other day saying that in terms of online pornography, 90% of online pornography now involves violence towards women, often involving strangulation as well. So a lot of young people are sort of growing up seeing that as kind of normal relationship behaviour, but there are some real risks associated with it. So thank you so much. I just see that's been popped in the chat there as well. The hidden dangers of non-fatal strangulation with Dr. Newbury. Really insightful, that one, so please do have a listen. But thank you. Is there anything else, Jasmine, Laura, Katie, you wanted to add to that at all?
No.
Great stuff. Okay. Well, I can't see any other questions in the chat. If there have gone in, have had anyone in there and I've missed them, I do apologise for that. It's not intentional, but I think that's all the questions that we've had. So thank you so much, everybody, for coming along to join us again. Don't forget, there's loads of ways of staying up to date with things. We have got our YouTube channel. That's where you can find the videos from all of the previous forum events we've had taking place. And as I mentioned earlier, you can find all the presentations, the materials, the links, the newsletter links on the SSCP website for all of the previous webinars that we've hosted as well. We've also got our learning bulletin, our monthly newsletter that comes out to you. It's the best way to stay up to date with things. We've got our social media. We've got our main one at the moment is our Facebook account, and we've got our podcast. I think we've got 56 or 57 episodes out there at the moment, and they are going out fortnightly as we speak. So it's a really good way of keeping up to speed with all these things. And we also bring you specials Like, for example, our last special we did was with Jasmine, talking about all the updates to working together to safeguard children. So if you've not caught that one, it's a really good way of getting up to speed with all of these changes that have now come in. So last thing for me, and it's just a very huge thank you to everybody to come and join us today. I know everyone's very busy at the moment, got lots of things on as always, but we really do appreciate you taking that little bit of time to come and join us here over your lunch break today. So thank you very much. We hope that's been useful for you, and we shall see you again, if not before, at our next forum event in December. All right. Thanks, everybody. Take care of yourselves. Have a good afternoon. Bye-bye.